have one more question. Well, I've
Yeah.
spoken to you before about the, I mean, through your own professional thing with people that you're doing in therapy.
Yeah.
Do you see the people with the swollen palms, like I told you I had, in the numbness in my hand? Do you think that I've never had this problem before the stroke, where my fingers feel really fat and they look a little bit fatter, not over accessible fat. It's just that they're hard for me to grip my hand. I mean,
Sure.
and the neurologist said that he thought it was maybe a slight case of carpal tunnel, but I told you he gave me a shot, but that did absolutely nothing. So I can
Yeah.
only assume that a lot of it is stroke related, but I don't have anything to work with. And you
Yeah.
do. I mean, do you see that with other stroke patients having fat fingers and a fat palm, where it's kind of like your fingers are stiff?
Yep. So I think it's a couple things. So after neurologic injury, there's actually kind of, let's say, 3 things that we can talk about. The first of those is maybe the easiest to describe. And that is, we got to just quickly understand a little bit about how fluids are moved in our bodies. Okay. So you and me, even though we look pretty solid, something like 70% of us is actually water, right? And there's water and fluid between each of our individual cells. And those fluids are what are called interstitial fluids between tissues. And those interstitial fluids are there to help move waste products around, all these sorts of things. We need it, basically. It helps with joint motion, these sort of things. Now, how do those, like, if you can imagine like a stagnant pond, right? A pond, if you find yourself in a retention pond, it's going to be pretty mucky, kind of gross water, right?
Right.
What you really need to do to have clean fluids, clean water, in my sort of analogy here, is you need to have motion through it. Okay. So like a fast moving stream is going to have much cleaner water than a stagnant pond or a very slow moving stream.
Okay.
When it comes to how that works under normal circumstances for an individual who hasn't had a neurologic injury, or even somebody who has, most of that sort of capacity to move fluids through our bodies is coming from muscles, interestingly enough, because what happens is the muscles will contract and relax, and that actually changes the pressures in each of our individual joint segments. And as those sort of muscles contract and relax, it's almost like a pump. It's actually, in the clinical world, called a muscle pump, where those muscles sort of contract and relax and help to return fluids back to our central cavity, where they get recirculated, et cetera, et cetera.
Right. And
so
that's what my
after neurologic injury,
and that's
exactly,
what my therapist said. But I sit there and squeeze silly putty, just to interrupt. I squeeze silly putty a lot during the day in my free time, especially when I go for a walk. I'll take the silly putty. And he said, just keep squeezing it. He goes, because that's exactly what he said. He goes, it'll be like a pump. He goes, make believe that it's a pump in your hand and you're just pumping that fluid back up through your arm. And I said, his name is Jim. I said, Jim, I squeeze that silly putty anywhere some days from an hour to 2 to 3 hours, depending on what I'm doing. I said, and it never changes. He goes, he goes, it's stroke related, Joe. He goes, and he goes, it's all going to depend on how your body is going to react to the stroke. Yeah.
And I think that's really good to bring up. And what I'll do is, so kudos to that therapist for bringing this up. It's important to mention these things. Now, I will extend upon what they're saying and maybe explain why, even with doing that, a lot of sort of gripping motion, why you still may not get your right and left sides may be different. And that comes down to the concept called resting tone. Okay. So under resting conditions, our nervous system will tonically fire and have some action on the muscles. And those muscles themselves will have some action on themselves. So there is like a resting tension in the muscles and some resting activity. And in certain cases for neurologic injury, those resting tensions can either be elevated or lowered. And in either of those cases, when you're not in the sort of optimum, if you will, kind of like a curve, an inverted U curve, if you're not at that optimum at the peak, you're going to have a poor functioning system. Because on the upper end, you can imagine those pumps, those sort of the sort of conduits by which the fluid gets returned are narrower, right? On the other side of that function, they're not pumping enough to cause it to be returned. So anything outside of optimal there can cause a problem. And unless you were to be doing it like 100% time of the day, it would be almost impossible to get that sort of optimum sort of resting tension back. It's not something that we can consciously control for.
Right.
These are subconscious type of automatic responses that happen. So that could be one thing. So that's on the muscle pump side, sort of the fluid retention.
Right.
The other thing about sort of this sort of sensation of tightness, of sort of chubby fingers, if you, as you described it, fat fingers, it can also be changes in the soft tissues. So things like your muscles can actually be physically changing their sort of structure, as well as the fascia and the ligaments and the tissues that help connect your muscles to your skin. So all those things can kind of be altered if we're not moving as normal, as we did before stroke. Those things can cause differences in the way that our muscles and sort of fingers interact, and it will give you that sensation of being sort of, I call them fat fingers. Like I don't know if you have this happen to you, but if I go for like a long hike, I will notice that I can't get my ring off, right? And oh man, that kind of thing. And it's really common for fluid retention, but the same sort of thing happens if you're not able to move as well. Those soft tissues can change, and you'll get that sort of fat finger sensation. And then on the sort of, those are the two aspects of it. And then the third one is kind of interacting with both of them. And that is on the nervous system side, if you're not getting those signals coming down, you'll basically have those muscles effectively not have as good as response. And in terms of the autonomic system as well, those things that monitor those normal sort of sensations can be altered as well. So it's not just the sensory motor problems that have impact on your sensations and your function, but it's also on the autonomic responses too. The autonomic nervous system is a part of the nervous system that we don't always think about because it's, again, subconscious, but it controls various aspects of things like how, your hunger systems, your respiratory systems, your digestion, a lot of your hormonal aspects. A lot of these things are very, very important. And sometimes they can be dysregulated following stroke as well. And so if those things are dysregulated, you can cause alterations in the way that fluid is being retained, et cetera, et cetera. The other thing that might be contributing to this, Joe, is if you're on other medications that could be causing some fluid retention. I don't know exactly what sort of...
No, actually, because I had some side effects from some of the meds, the cardiologist said, I was always tired, and he had me on some medications. He goes, that could cause it. He goes, let's just wean you off. So pretty much I'm weaned off all the meds. So I pretty much don't take anything for the stroke that I had anymore. And as I say, I've never had this problem with my hand feeling always like it's swollen. And I told you, it's only on the palm side. And and I'm just thinking that I know that doing this Motus Nova hand unit and training my brain to relearn and to reroute the path, I'm saying I know that there is a possibility that if the switch may get turned on or reroute itself. But I'm thinking, I like to play golf, and I can grip a golf club, but because of the numbness still in my fingers, I don't have that feel in that left hand. And because the club is a little, my hand is a little fat, I just don't have that sensation because I've been trying to exercise, doing the things that I like. And I'm thinking, what, is it possible that could always be there? I mean, I know that we don't want to hear that negative part of it, but is it possible that Joe, that may be a problem that may not go away?
Yeah, and I think it certainly could be, and it's a matter too of it may take time. Your body is also sort of reorienting itself to your new baseline, right? This is Joe post-stroke. And it may happen where, there is a possibility, again, I haven't done any measurements of your fingers per se. What could be happening is your fingers are actually not any different, right? There could be a potential where the physical measurements of your fingers are not any different, your hands any different. It's the way that your brain is maybe interpreting those signals, in which case it's for whatever reason, is misinterpreting them as being, oh, I'm getting this weird sort of sensation, this fat feeling. So that could be something that you would adapt to over time, right? You would just kind of integrate it back into your normal sort of sense of yourself, and hopefully that would attenuate over time. Now, there is, you're exactly right. There is a possibility. There is, in the solution set, there is a possibility that it may just be part of your new you.
Okay.
It's going to be, it's going to be impossible for me to say, I think. One thing that we might want to do is, it sounds like you're doing a lot of motion, a lot of activities.
Yes.
With your hand. Now, I would actually be interested to see, you can actually overdo it to a certain extent with respect to like trying to compensate for that feeling. It'd be interesting to see if you stopped doing, let's say, the putty for like a day or so, and see if that made it worse or better, or the same. Because the thing we would want to know is, if you're overdoing it and you gave yourself a rest for a day or so and it got better, that would indicate that maybe there's actually some overuse happening, and you're just causing a low level of inflammation, and there actually is some inflammation that's happening because, and I guess edema, which is fluid accumulation, because of that.
Right.
So for me, I don't like to change multiple things at once. I like to just change one thing and see what the effect is. So it might be interesting to try that, just to see.
Well, I have an orthopedic doctor friend of mine, and he always says when you're sleeping, elevate your arm up. And I tell him, Doc, I elevate my hand for days on end at night and nothing changes. He goes, no, you got to get it above your heart. I said, I have it above my heart. I said, the only thing I can do to make it even better is tie a string around my wrist and have it hanging from the ceiling. I said, it's not getting any better. I said, that's what he said. When go to the neurologist and have him look at it with an EEG and other things. But it doesn't. Sure. Now, I can just mention one thing. If I took my right hand and put it around, say, like a stick, because the therapist has you rolling your wrist. And if I put my left hand around, you'll see that my fingers don't go around the stick as far as my right hand does, my good hand.
Okay.
And I look at it. So, and if I take my fist and close my fist, my good hand, and then and I can close my hand with my left hand, my stroke hand. And I just can't get my fingers because they're fat. They just won't let me go to that same position, So I understand what you're saying, that maybe your brain is telling you that your fingers are fat, and they're not. Now, the occupational therapist, she measured my hand, and she said that you're definitely bigger in your stroke hand than you are in your right hand. So,
gotcha.
So, I mean, because this is all new to me, and I sit there and I just say, well, common sense. If it's not that the neurologist said that this didn't work, and anything else didn't work, I'm just saying, this is what the stroke has done. It's just not letting that signal go back to my hand and say, you're not pumping that fluid out of there yet. And I'm thinking, I'm just hoping that will change eventually. And, I can get full extension, but on my hand, I can put my hand straight up and down just about. But it's amazing when I hold my fingers up for about a minute or two, which is a long time. I can actually feel the rubber bands in my fingers saying, you better, we're getting tired, and your fingers are starting to close down. But because I've been doing that as an exercise, I've been getting longer durations of holding my fingers up, and I don't start to feel that band until maybe after a minute, if you understand what I'm saying. It actually feels like I have rubber bands Yeah, I actually feel like I have rubber bands on the inside of my fingers saying you're getting tired, where I can actually feel myself, my hands starting to shake because I'm getting fatigued. So, but I've been able, go ahead.
Go ahead, Joe.
Yeah, so so I've been doing all kinds of crazy exercises because I know my body better than anybody does, even though I listen to all the therapy people and I do the things they tell me to do. But then I try to say, well, if you do this and it's like anything else. If your body's weak and you do it enough, you'll strengthen that area of your body up. And if I hold my fingers up as straight as I can for as long as I can, I found that by doing that, I'm able to hold my fingers up for a longer period of time. I mean, it's funny how when you put your right hand up, the good hand, your hand just, I could stay there all day with it. But with my stroke hand, it's like, wow, you know, I feel that it's learning and it's stretching those tendons or whatever it is. But I'm thinking, oh my God, I'm gonna have to do this every day to get my hand back into used to and stretching those tendons out to get it to stay up there just normally like it used to when I wanted to. You know, so
yeah, and I think Joe, you're doing exactly the right things, right? And I think for me is if you've been doing a lot, the reason I'm bringing up the idea of kind of backing up on something is because if you've been doing a lot, there's a point at which there's going to be some diminishing returns to things, or potentially some adverse effects. So it might be good just to try it, right? In my mind, if we just take a day or two, and you stop doing some of those, say the squeeze ball or the silly putty,
right?
If you stop doing that and it gets, let's say, better, that those sensations get better, that's telling me something.
Yeah.
Alternatively, if it doesn't get any better, then that would be interesting. But if it gets worse, that's telling me that what you're doing is actually helping you, right? For me, I want to know what's actually helping you and what's not helping you, and I only want to do those things that are actually helping you, because it's also more efficient. And so it's also because there's so many things that are so individualized with stroke recovery. We need to figure out what's that perfect level of activity for you to cause the positive changes that we want, but not to overdo it where it has the potential to hurt you, right?
Right.
That's what we don't want to have happen. And so that's why I'm saying, let's just try it for a little bit and see what happens. And then, for instance, if you stop doing it for a day and you start to get more sensations where it feels like your hand's even worse, then go back to doing it. You've already gotten positive confirmation that the thing you're doing is actually helping.
All right.
Outside of that, you're just doing more and more things,
Okay. I can do that. It's easy.